Welcome to the second lecture of the educational program. Today we will look at how to apply evidence-based practice to select treatment options for patients. This is the objectives of today's lecture. At the end of the lecture, you should be able to apply steps in EBP, basically ask and acquire, critically appraise the evidence related to treatment, and interpret RRR, relative risk reduction, ARR, absolute risk reduction, and NNT, number needed to treat. In order to understand the concepts, we will look at this patient scenario. A 63-year-old man had been pointed out to have increased LDL cholesterol in an annual medical examination. He visited an outpatient clinic for the first time in the last month and received guidance on nutrition and exercise. He began to take a walk every day. His lipid profile after 3 months is total cholesterol 258 mg per deciliter, LDL 174 mg per deciliter, HDL 42 mg per deciliter. Past medical history is not significant. Family history: his father suffers from myocardial infarction in his 50s. Social history: he is a company worker, smoking 18 cigarettes per day for 40 years, drinking 2 cans of beer per day. Examination: BP is 130/80 and weight is 75 and height is 172. So let's revise the steps of EBP here. So the basic steps of EBP is ask, acquire, appraise, apply, and assess. First step of EBP is ask. So we will see how to ask well-formulated clinical question. In this case, we will analyze the patient problem. So the patient is having high cholesterol level. At the moment, he doesn't have any cardiovascular events. Risk factors are smoking and alcohol consumption, and there's a family history of myocardial infarction. So the management up to this point is he is on lifestyle modifications, basically the diet and exercise. So what will be the next step in the management of these patients? So here we need to identify whether it is helpful if we start a statin as a treatment. Let's use the PICO acronym to simplify the important parts. So P is for patient problem. So here the patient problem is patient with high cholesterol with no history of cardiovascular disease. So the intervention is when treated with statin, and the comparison is compared to the control group who doesn't use statins, and the outcome is does the mortality rate in cardiovascular disease decrease. The next important point is where to find the details about the usage of statins to answer our question. So this is the pyramid of research design and level of evidence. So the top of the pyramid is the best sources to answer your question. So in the top is randomized controlled trials and systematic reviews. So here is another pyramid which includes more sources. So here I want to show you the other sources like clinical guidelines and where they stand. So as you all can see, it is in the top of this pyramid. So it is higher than the randomized control trials and systemic reviews. So you can find the clinical guidelines in this area of the pyramid. So it is in a higher level. I'm sure you all know about the clinical guidelines. So what are clinical guidelines? They are statements that include recommendation intended to optimize patient care that are informed by systematic reviews of evidence and an assessment of benefits and harms of alternative care options. And there are several guidelines you can look for according to your subject and the topic of interest. In this case, we will use the NICE guidelines. NICE guidelines are developed by the National Institute for Health and Care Excellence in UK, and it provides guidance and advice to improve health and social care. Who is involved in making the guidelines? So it is by independent communities, including professionals and lay members, and consulted on by stakeholders. They use the best available evidence to develop recommendations to improve health and social care. So we will go through the NICE guideline to answer our question. Please try to read the guideline in the given link. So this is what is there in the NICE guideline. We will go through them first. So the statement 1 is adults under 85 years with an estimated increased risk of cardiovascular diseases are offered a full formal risk assessment using the QRIS-2 tool. Then the second statement, adults with a 10-year risk of CVD of 10% or more are assessed for secondary causes before any offer of statin therapy. And the statement 3 is adults with a 10-year-old risk of CVD of 10% or more receive advice on lifestyle changes before any offer of statin therapy. And the fourth statement is adults with a 10-year risk of CVD of 10% or more for whom lifestyle changes are ineffective or inappropriate, discuss the risks and benefit of starting statin therapy with their healthcare professional. Then the fifth statement, adults choosing statin therapy for the primary prevention of CVD are offered atorvastatin 20 mg. So we will try to apply these steps for our patients. So we will first do the full formal risk assessment for our patient. We have to use the QRIS-2 for that. So QRIS-2 is an online assessment tool for estimating the 10-year risk of having cardiovascular event in people who do not already have heart disease, which is similar to our patient. A person's 10-year risk of CVD can be used to inform treatment decisions such as lifestyle advice or drug treatment. So here is the link for the QRIS-2 tool. This is the interface of QRIS-2. We have to enter the details of our patient here. So we will add the details of our patient. So here is the age is 64 and the sex is male. So ethnicity you can select from this drop down button. So we will put as other Asian, and then we have to put the investigation findings and examination findings. So cholesterol and HDL ratio is 5.4 in this patient, and the systolic blood pressure is 130, and the height and the weight, height is 172 and weight is 75. So according to the tool, the risk of CVD for a patient is 21.8%. So this is higher than 10%. So we will go through the next steps. As a patient has a 10-year risk of CVD of 21%, which is higher than 10%, according to statement 2, we have to assess the secondary causes before offering statin therapy. So these are the secondary causes we have to think of: smoking status, alcohol consumption, blood pressure, body mass index, HbA1c, renal function and estimated glomerular filtration rate, EGFR, and the transaminase level and TSH. So according to the given history, there's a history of smoking and alcohol consumption. So we have found the secondary causes for the hypertension. And according to statement 3, receive advice on lifestyle changes before offering statin therapy. So according to this, the history, lifestyle modifications are already done. And then the statement 4 is discuss the risk and benefits of starting statin therapy. So we have to do this with our patient. And the statement 5, after that discussion, we have to start atorvastatin 20 milligram. Now we are in the step 4 of EBP, and I would like to revise the definition of EBP. We have to apply the three things: the evidence, the values of the patients, and the clinical expertise in decision making. So we have to think of all the three components when we are applying EBP. Now we will try to apply evidence-based practice in our patient. So in this case, what will be the best scientific evidence? So the best scientific evidence will be, as this patient has an increased risk of CVD, according to the clinical guidelines, it is accepted to start the atorvastatin in this patient. So what about the values and expectations of the patient? So this is what the patient has discussed. My father died of myocardial infarction at the age of 65 as he didn't manage his health properly. I would like to take a pill to control my cholesterol level, but I have few concerns about it. I am concerned about the price of the pill and whether I have to take that for my whole life. So here we have to address the concerns of the patient and we have to discuss about. And then the clinical expertise. There is a family history and there is another risk factors like smoking and alcohol consumption. So it is better to recommend atorvastatin for the time being. So as the initial step, we have to start atorvastatin in this patient considering all the above three components of EBP. So this is how we have to apply evidence-based practice. So we will look at the conversation between the doctor and the patient.
Mr. Pereira, though you have done exercises and control your diet, your level of cholesterol is still high. As you have a family history of MI, it is worth starting the medicine called atorvastatin. We will initially start a very low dose and let me see you in 1 month. What do you think?
And the patient replies,
Okay, doctor. I think it is good. My father also died of MI. I think I should take the medication. Otherwise, my family has to suffer because of my disease.
As the doctor did in this scenario, we have to always think about the values of the patients when applying evidence-based practice. Then we will look at this patient scenario too. The patient is a 64-year-old female with a long history of type 2 diabetes and obesity. Otherwise, her medical history is unremarkable. She had a knee surgery 6 years ago but has had no other major medical problems. She has tried numerous diets and exercise programs to reduce her weight, but it has not been very successful. Her daughter has a 4-year-old son whom she wanted to play with, but she feels that she is less mobile due to her weight. She is frustrated that she cannot lose the necessary weight. Her neighbor told her about a woman who had a stomach surgery and as a result lost over 40 kg. She wants to know whether she can cure her diabetes by this surgery. I'm sure the scenario is clear for you. So now let's try to apply the steps of evidence-based practice to answer the patient problem. First, we will try to formulate the PICO question to analyze our patient's problem. Here, the patient problem is obese patient with type 2 diabetes mellitus, and the intervention is bariatric surgery, and the comparison is standard treatment, and the outcome is remission of diabetes. Before going into search the details, I would like to explain the broad term I used, the bariatric surgery. It refers to surgical procedures that assist in weight loss by making changes to the digestive tract. These are some of the examples for them which you can clearly see by the picture. Now we have completed the first step of EBP, which is ask or formulating a well-built clinical question. Now we will move to the second step, which is acquire, So you decided to do a PubMed search and find out a study which is suitable for your clinical question. So why should you learn to search for individual studies? It is due to the limitations in guidelines. For example, it might be outdated or in the process of being updated, or sometimes there may be some newer disease conditions which might not have clear guidelines. For example, the COVID-19 pandemic. So when the beginning of the disease, there is no clear clinical guidelines developed. So in that case, you have to go to individual studies. So this is the study you have found out when you are searching in the PubMed, and here is the link for the study. So please go to the link and read the research paper carefully. So this is from the New England Journal of Medicine, and the title is Bariatric Surgery versus Intensive Medical Therapy in Obese Patients with Diabetes. So the next important question is, how will you assess the quality and the applicability of the evidence? As we are in step 3, which is appraising evidence, these are the things that we need to consider. There are 8 things, so we will go one by one. Was the assignment of patient to study and control group randomized? Were study and the control groups similar at the start of the trial? Apart from the intervention under investigation, were both groups treated equally? Were all patients accounted for and analyzed in the groups to which they were originally allocated? Were measures objectives, or were participants and clinicians kept blind to which treatment was being received? How large is the treatment effect and how precise is the estimate of treatment effect? Are the results applicable in my clinical setting? Now we will try to appraise the study by answering the above questions one by one. So the first question is, was the assignment of the patient to the study and the control group randomized? So randomization is one of the important things done in randomized control trials. I'm sure you can recall what is randomization is. So where can we find the details about the randomization when reading the article? Actually, it can be obtained from the methods section. As seen by this paper, in the methods section, it says, in this randomized non-blinded single center trial. So this word randomized is here in the methods section. So you have to see the methods section to find out whether any study is randomized or not. The second question is, were study and control groups similar at the start of the trial? When reading this paper, this table reflects that the characteristics of the study and control groups are similar. Here you can see the characteristic and the number of participants here in each group. So the characteristic is duration of diabetes, kind of similar, and use of insulin, kind of similar, and the age is also kind of similar. So the characteristics of the two groups are similar in this study. So the third question is, apart from the intervention and investigation, were both groups treated equally? To answer this question, we have to look into the methods section for a follow-up schedule and permitted additional treatments. The fourth question is, were all the patients accounted for and analyzed in the groups to which they were originally allocated? The results section should state how many patients were randomized and how many were included in the analysis. So losses to follow-up should be minimal. Usually it should be less than 20%. So in this section of the paper, it says about the follow-up of the patients. The fifth question is, were measures objective, or were participants and clinicians kept blind to which treatment was being received? Usually, methods section will reveal whether the study is blinded, and ideally, a study should be double-blinded. But as you can see, this study is a non-blinded study. Why this is non-blinded? Because this is a surgical procedure and it is difficult to do as a blinded study, which is quite acceptable. Then we have to assess how large is the treatment effect. Before that, we need to understand these concepts: the event rate, control event rate, and the experiment event rate. So, event rate is the proportion of people in the population who experienced a particular event. And the control event rate is the control group event rate. And the experiment event rate is the experiment group event rate. To calculate the treatment effect, we need to calculate the relative risk reduction, absolute risk reduction, and number needed to treat. So the relative risk reduction is the proportional reduction in rates of bad outcomes between experimental and the control participants in a trial. So it is given by the following equation: control event rate minus experimental event rate divided by control event rate. And the absolute risk reduction is the absolute arithmetic difference between the intervention and control groups, and the equation is control event rate minus experiment event rate. And the number needed to treat is the number of people that needed to be treated in order to achieve an event once. An intervention with a smaller NNT is more effective. So this is the calculation for NNT. Now we will try to calculate the treatment effect. In this study, the gastric bypass patients are in the experiment group and the patients who undergone medical therapy is in the control group. So the control event rate can be calculated by dividing the number of patients who undergone medical therapy with no remission of diabetes, that is 36, divided by the total number of patients who have undergone medical therapy, that is 41. So the control event rate is 0.88. Then the experiment event rate can be calculated by the patients in the gastric bypass group with no remission of diabetes divided by the total number of patients who undergone the gastric bypass, so that is 0.58. Then we'll try to calculate the relative risk reduction. So relative risk reduction can be obtained by CER minus EER divided by CER. So after the calculation you get the number of 0.34, and the absolute risk reduction can be obtained by CER minus EER, that is 0.3 in this case, and the number needed to treat can be calculated by this equation, so it is 3.3. The next important point is how precise is the estimate of treatment effect. We can find out how close the estimate of treatment effects is to the true value by looking at the confidence interval. So what is confidence interval? Confidence interval is an estimate of range of values that will include real value. A confidence interval of 95% means that there is a 95% chance that the real value is included in the study results. So we have to look at the 95% confidence intervals in the treatment effect. Finally, we have to think whether the results are applicable in your study setting. So you need to consider the following factors. Is my patient similar enough to those in the study? Is the treatment feasible or affordable? Are the potential benefits worth the potential risks to the patient and or the costs involved in implementing a change in practice? So you have to apply these points to your patient. Now we will try to go to the next step of EBP, which is apply. So this is the best evidence. In this study, the NNT is 3, which means if 3 patients has undergone gastric bypass surgery, 1 patient can be cured of diabetes mellitus. And regarding the patient's values and expectations, this is the speech of the patient. I want to cure my diabetes and lose weight at the same time. I am taking my diabetic medications and controlling my diet for a very long time. I feel frustrated as diet or exercise or medicine didn't help me in losing weight or curing my diabetes. I would like to try this surgery if it can help me losing weight fast and cure my diabetes. Then the clinical expertise. As this patient is obese patient with diabetes who has tried both medicine and lifestyle modifications, the bariatric surgery will be an alternative as it has quite successful rates in curing diabetes mellitus according to the study. So this is the discussion between the doctor and the patient after applying the steps of EBP. The doctor speaks.
I know that you are worried about diabetes and the difficulty of losing weight. According to the current research, stomach surgery has proven to be effective to cure diabetes and weight loss. What do you think about undergoing the surgery?
Well, doctor, as I have tried almost everything which didn't work for me, I would like to consider the surgery if it is safe for me.
I can understand your feelings. We need to refer you to other doctors and do other tests to find out whether you are fit to undergo the surgery. In the meanwhile, you should inform this to your children and ask their opinion as well.
Thank you very much, doctor. I must ask from my children as they care for me. I will come back to you with my daughter next time. Thank you.
As you can see, this is how we have to apply the steps of evidence-based practice by applying the best scientific evidence and the patient's values and expectations and also the clinical expertise. So this is the end of today's lecture and this is the summary of the session. The importance of evidence-based practice for treatment decision making, importance of clinical guidelines in clinical decision making and the appraisal of randomized controlled trial, and the importance of concepts of RRR, ARR and NNT. And thank you very much for listening to me in this lecture. And next you will have a group discussion in the Google Classroom. So please do that group work with your group mates. Thank you.